And the next step is to find the landmarks on the patient's knee. So first I just feel the patella, and I feel the lateral edge, and then I also want to find the inferior aspect. And then I take where the lateral edge and the inferior aspect intersect. It's also where the little soft spot is. If you're having trouble feeling that on the patient, you can have them move their knee back and forth a couple of times, and that can help find the bottom of the patella and kind of feel where that joint moves. So check that one more time. And then I like to use the betadine stick to mark the spot. You can also use anything from a surgical marker to even a makeup pencil. And if you're first learning and a little bit nervous about the landmarks, you can even use that surgical marker or makeup pencil to draw your lines and look for that intersection spot. Can just give you a little more reassurance about where you're going. Alcohol wipe. The cold spray tends to run down their leg, so I like to place the gauze underneath where I'm going to spray to catch, and then I do 10 to 12 inches away from the knee. And wait until it starts to turn white, blanch. You getting nice and cold? There we go. And then we go at about a 45-degree angle. 1, 2, 3, little poke. Try to poke fairly quickly, but then move the needle in a little bit more slowly. Aspirate just a little bit. Doing okay?
Doing great. Yeah, it's really weird because last week the right one was more uncomfortable with pressure. This week it's just the opposite. It's strange.
So I was getting a little bit of resistance. So you saw how I just redirected the needle a little bit until I got a nice smooth flow of the viscosupplementation. Sometimes if you're up against the femur bone a little bit, you'll get some resistance. So then just by redirecting slightly, I got a nice smooth flow. So you shouldn't have much resistance at all, and the patient should just feel a little bit of pressure. They shouldn't feel a sharp pain.